Hi Farmies, I would like to talk to you today about a leukotriene modifier. Alright, so what is it going to be? What medication do we have that has the word leuc in it somewhere for our respiratory meds? And it's going to be Montelukast. So Montelukast is singular. It is another asthma medication, but the key to this one is that it is not a rescue med. It is to reduce inflammation on a regular basis. So this is a preventative. We're going to try to decrease airway inflammation and bronchoconstriction. And so it's a med that you're going to take at night, or you're going to take it a couple of hours before exercise. The way this one works, this is a receptor blocker. So even though it is called a modifier, you could think of it as a blocker. So leukotrienes are located, those receptors are located in your lungs. So here's a really pretty picture of your lungs. And if you think of the receptors, the leukotriene receptors as being little round circles all over your airways. And then think of your Montelukast tablet as a little round pill. It's going to fit right into those receptors in your smooth bronchial tubes, and it's going to block those receptors so that the leukotrienes, they're kind of in the same sort of leukotrienes are kind of like histamines. They're released by mast cells, and if they end up fitting into those receptors, if an actual leukotriene ends up in here, you're going to have constriction and sort of an allergic reaction. Inflammation is going to happen. So we want to block those receptors with Montelukast instead. And so in order for you to remember that this is a medication where we really want to monitor progress over a long term, I've included a little happy face up here with a peak flow meter. So hopefully you've gotten to lay hands on these in sim and lab, but you're going to take peak flow measurements before you begin treatment, and then you're going to take peak flow measurements throughout treatment to make sure that the treatment is effective. So this is the evaluation piece, the E at the end of your ADPI. How do we evaluate if this medication is effective? We're going to use our peak flow meter. And then one of the side effects that can happen, he would have not such a happy face, but he can get a headache. So he's got a little X up here on his head and it says, ouch. So he can get a headache as a side effect. There are several side effects. And you might have an increase in liver enzymes because it is processed, it's absorbed through the GI tract and processed in the liver. So you would want to monitor those kind of things. But overall, if you can remember that this is a leukotriene receptor blocker, it's going to reduce inflammation in the smooth airways of the lungs. I love this lung picture. This is like artwork. Montelukast fits into those receptors instead. So it's going to block the action of leukotrienes. You're going to monitor it with a peak flow meter, and you're going to let your patient know they might get a headache. All right, I hope this helps you remember singular Montelukast.